Hi, everyone. Thank you for joining us. This is Janice Hale with the Rock Island County Health Department. Today is March 23rd, 2021. And with us today, we have Amy Thorson, the Interim Director of the Scott County Health Department, and Neva Ludwig, the Administrator of the Rock Island County Health Department. Both will be talking about vaccine availability. First of all, Neva, let's start off with some Rock Island County numbers, please.
Sure. Today we do have 21 new cases of COVID-19 in Rock Island County, and that brings our total now to 13,237. There are currently 12 people hospitalized in Rock Island County with COVID-19, and our deaths remain at 306 for our county.
In Scott County, there have been 18,843 positive tests. Our 7-day positivity rate is 9% compared to 4% last week. So that's not the right direction. We've had 224 deaths of Scott County residents. On some good news, 22,700 Scott County residents have been fully vaccinated.
So we told you from the beginning that when vaccine was administered in Rock Island County back in December, that everyone's turn would come, and that arrives on April 12th. On that day, every Illinois resident age 16 and older will be eligible for the COVID-19 vaccine. Already, 50,000 Rock Island County residents have received at least one dose, and almost 18,000 have been fully vaccinated. This week, higher education staff, government workers, and media members become eligible. Next Monday, food and beverage workers, construction workers, and religious leaders will get their shot. And then on April 12th, everyone gets their turn. Our clinic at Camden Center in Milan is ready for the influx of people. The team of health department staff and volunteers and 63 National Guard soldiers and more than 20 contract nurses with the Illinois Department of Public Health can vaccinate up to 6,000 people a week. That's of course dependent on vaccine supply. Add to the total of slots available at our healthcare and pharmacy partners, and you can start to see that there is an end to this whole ordeal. Getting your COVID-19 vaccine will protect you and those you love from this dangerous and deadly disease and help us all get back to normal. The vaccines are safe and effective, and millions of people of all races and ethnic backgrounds have safely received their shots. All Illinois residents age 16 and older can get their vaccines for free at the Camden Center in Milan. To make an appointment, find the registration links at richd.org or on the Rock Island County Health Department Facebook page. The health department must rely on a vendor with the state to create the links for each of these clinic days. We are all frustrated that the links have not become available on a set schedule, and we urge you to check the Facebook and website frequently. We just recently added about 20 minutes to a half hour ago the links for Thursday and Friday, and Saturday to come very soon. Starting next month, the state of Illinois is expecting more than 1 million doses coming into the state each week, and thousands of them will be coming to Rock Island County. We know that not every person age 65 and older has been able to get vaccinated yet. We are getting through the waiting list created through our partnership with Alternatives for the Older Adult. The Chief Executive Officer, Kathy Wyman, and her team have been shepherding thousands of older Rock Island County residents through the Milan Clinic and will continue until every person on their list has been fully vaccinated. Much of the registration process has been online, which is difficult for some people in our community. Please consider helping older residents and those without consistent internet access sign up for the vaccine. Right now, Alternatives is taking calls from Rock Island County residents who are 60 and older. Those residents who qualify can call 1-833-382-1314 from 9 a.m. to 3 p.m. Monday through Thursday. Once the 60 and older population has been vaccinated, Alternatives will transition the support to the QCon Hub, and that's a collaboration of more than 80 partner agencies. This contact information will be shared in the coming week. Your shot is coming. Please take it. Thank you.
Last week, Governor Reynolds announced that beginning April 5th, all Iowa adults would be eligible for COVID-19 vaccine if vaccine supply increases as expected between now and then. If we find that on April 5th, all Iowa adults are eligible, this will be a good sign. It will mean that there is confidence that the vaccine supply that will come into the state each week will be increasing to a level where it will begin to be more readily available. This is something we've been waiting for since the first vaccines arrived in Scott County in December. However, as we have seen with all of the vaccine eligibility transitions that have taken place over the last 3 months, just because all adults may become eligible on April 5th does not mean every adult will be able to get a dose of vaccine on April 5th. It will take weeks and maybe months for supply to fully arrive, vaccine appointments to be created and scheduled, and for vaccines to be given. The April 5th date that was announced is approximately 2 weeks away, and we know a lot can take place between now and then. So we in public health remain cautiously optimistic about what the next 2 weeks holds. If you are a member of the general public that will potentially become eligible, the only thing you need to do right now is finalize your decision about getting vaccinated. The way we see it in the public health world, you're going to be eligible for a safe and very effective life-saving tool to help protect yourself and your family, friends, and community. You choosing to get the available vaccine will take us another step closer to the end of this long and exhausting pandemic. It will mean our futures can be filled with gatherings, events, and faces that can show a smile when greeting each other. If you're still on the fence, we encourage you to talk to others who have been vaccinated. Ask them their why. Why did they choose to be vaccinated against COVID-19? There's a good chance some of their reasons may become your reasons for saying yes to a vaccine when it's your turn. For all of us, it is still important to do the things that we can to keep each other safe and healthy. Wear a mask, keep your distance, wash your hands, and stay home if you are sick. We have seen our decline in COVID-19 cases level out and slowly begin to rise again. We do not want to go backwards while there is so much hope and excitement for the future.
Thank you so much, Nita and Amy. If our media partners have any questions, please type those in. Amy, we do have one that's popped up for Scott County. It's mentioned that the positivity rate is up to 9%. Do you have any idea what might have caused this twofold increase in a week? And are there any outbreaks being traced in the county?
I'll start with the second question first. There are no outbreaks being traced in the county that we are aware of at this time. I think one of the reasons for the increase is the number of tests. We reported last week we had been averaging about 2,000 tests a week. Last week there was only about 1,000 or under 1,000 tests done. So we know that testing volume impacts that percent. But we also know that we're starting to see an increase in the actual case numbers as well.
Thank you. Okay, I don't see any additional questions, so we'll go ahead and conclude today's briefing. Recognizing that there isn't a lot that's changing and actionable right now for our community, we are looking at going to a once-a-week briefing from Public Health. We will change that if we need to, but at this time we'll be looking at potentially using Tuesday afternoons as our ability to make information available to you all and to the community. Again, should things change in the midst of that, we will make changes as needed. But recognizing where we're at, we feel that's the best use right now of our ability to communicate through this medium. So thank you all to our media partners for all you've been doing over this last year to assist us. And we look forward to continuing to work with you in the upcoming days and weeks of the response to this pandemic. Thank you all for joining us today, and we will talk with you again next week. Again next week.